Hello, everyone. Welcome to this month's NY Cannabis Grand Rounds, dedicated to advancing knowledge of cannabis in healthcare. My name is Sang Choi. I am a pharmacist and a research scientist at the Office of Cannabis Management in New York State. So in recognition of our Older Americans Month, today we have a panel discussion, and the title is Empowering Seniors Advancing Medical Cannabis Access in New York. But before I start, I do have to read a disclaimer. So let me read that to you right now. The views and opinions expressed in this live event are those of the speakers and do not necessarily reflect the views or positions of the Office of Cannabis Management. The Office of Cannabis Management makes no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the contents and expressly disclaims liability of the opinions expressed. The appearance of these speakers is for the information and convenience of the public and does not constitute endorsement, recommendation, or favoring by the Office of Cannabis Management. So today's topic is a very important topic to discuss because we know that there's an evolving landscape as it comes to medical cannabis use among seniors in New York State. But across the country, cannabis use among adults age 65 and older has risen by 3.8% in the last 8 years. And in New York State, approximately 30% of medical cannabis patients are over the age of 60. Research also suggests that older adults who consume cannabis most often do so to reduce pain, improve sleep, and manage anxiety and depression. So in this discussion, we'll talk about many different things as it relates to seniors, but the thing that I do want to emphasize is, when I was working at a dispensary, the question that I would get the most is, or the comment, when someone first came in would be, I do not want to get high and I do not want to smoke. So, which is great because there are alternatives to that. So I just want to talk about that. And our pharmacist, Kevin King from Fluent, will touch upon that. But also, what are the options for seniors or, patients who can't come into the dispensary? So we're going to talk about caregivers and caregiver facilities as well. So a caregiver must be 21 years of age, and a caregiver can oversee up to 4 patients, and a patient can have up to 5 caregivers. And there's a very important especially for senior living facilities, camps, schools, and things like that, there is something called a designated caregiver facility as well. And these facilities are able to obtain, store, and dispense medical cannabis for patients. There are no limit to the number of patients that this license or this registration takes care of. So if you're a facility and would like additional information, please reach out to us and we can give you more information at medical@ocm.ny.gov. And we'll also put that in the chat at the end of the discussion. So I am very excited to introduce our panel today. So we have a doctor, we have a pharmacist, and a caregiver. So let's start with Dr. Ken Weinberg. Welcome. So Dr. Ken Weinberg is a 3-time board-certified emergency medicine physician. He is an author who just published his book, Exquisite Moments of Sorrow and Grace, where he talks about his experiences with patients in the ER. And he's also the chief medical officer for Cannabis Doctors of New York, who in 2016 became one of the earliest providers registered by New York State to certify patients to receive medical cannabis. And since then, he has increasingly focused on using medical cannabis to treat patients with dementia and with very gratifying results. Welcome, Dr. Weinberg. So next we have Kevin King, PharmD. He is a pharmacist at the medical dispensary called Fluent. And he is so basically his journey into healthcare field was shaped by a personal experience as he overcame a traumatic leg amputation as a child. This life-changing event ignited his commitment to healing and led him to pursue a career in pharmacy. He began his professional path in a compounding pharmacy and wellness center where he focused on functional medicine and holistic approaches to health. He transitioned into the medical cannabis industry when it launched in New York in 2016. And over the past 9 years, he has been an integral part of the state's medical cannabis landscape, applying his expertise to enhance patient care and champion the importance of research and evidence-based practices in his evolving field. Welcome, Kevin. And lastly, we have Dr. Walter Flamenbaum, who is a caregiver for his wife. He is in his early 80s, but you wouldn't know that. And his wife and he have been married for more than 60 years. He has been a physician, a board certified internist, nephrologist, and clinical pharmacologist for nearly 60 years. And he switched from the practice of medicine to the business of medicine about midway through his career. His wife was diagnosed with dementia 4 years ago, but in retrospect had cognitive decline beginning some years prior. He has spent the last 4 years learning how to adapt and deal as a care provider with the care partner, having all the changes typical of moderate to severe dementia. The use of cannabis over the past 5 months has resulted in positive changes in behavior, affect, and even to the extent in memory. But the dominant effect has been on her social skills. Thank you, Dr. Flamenbaum. Welcome. So let's start our discussion today. So, Dr. Weinberg, I wanted to ask you, so what conditions do you most commonly certify for, and what factors guide your recommendations, especially when it comes to the senior population?
Yeah, well, across the board, not just including seniors, I'm seeing, I'd say, and I think this is probably true for most practitioners, chronic pain is the most common thing I'm seeing. I'm seeing also a lot of autoimmune disease across the spectrum, which has been very gratifying. That was one of the first things I saw, that people with autoimmune diseases, especially like Crohn's, things like that, did so well. And in terms of what the question was really how I determine what, say it again.
Yeah, like what do you most commonly certify patients for?
Yeah, those are the issues. And now, really, in the last several years, I've been doing a lot with patients with elderly patients, especially those with cognitive issues.
Okay. Well, thank you. So Walter, what prompted you and your wife to explore medical cannabis as part of her clinical care?
Let me at the outset be clear. This was not something that my wife sought to do. I think many patients with dementia are not able to make that as an active decision. So I'll take this upon myself. After chatting with her geriatric care manager, Amanda Clears, who introduced me to Ken, it was clear that there have been sequential changes over probably the prior year that were amenable to treatment with cannabis. Her social skills, which had deteriorated, became problematic. She was not getting along well with either the other residents or with some of the co-workers. Just 1 second. Believe it or not, someone's knocking on my door.
Okay, we'll go back to Walter. So let's just go over the certification process. So basically, a patient who is seeking a certification will find a practitioner who can certify a patient. And we have the list of practitioners on our website, cannabis.ny.gov. And basically, you would make an appointment to see this practitioner either virtually or in person. Once you meet with the practitioner, they will deem you, they would see if you qualify actually for a certification, and they will certify you. So, and then you're automatically registered into the medical cannabis data system in New York State. And with that, you can take that to your medical dispensary, make sure to take your certification with the government issued ID, or you can have it digitally on your phone. And then the pharmacist there will help you navigate the different types of products that there are, the condition that you're trying to get symptomatic relief from, and you can purchase your product from there. So Dr. Flamenbaum, do you want to finish what you were saying?
Yes, I'm sorry, but my cat can't answer the door. She can't reach the doorknob. It was suggested because of change in affect. She was a less happy person. Change in communication. She kind of withdrew into herself and started to spend more time alone. And just an overall change that was a deterioration in her overall functions. She introduced me to Ken, Amanda, and I talked about it, and it was clear that what was going on was amenable to therapy with cannabis. Ken did a thorough evaluation, and between Ken, Kevin, and you, Sang, a prescription was put together that was designed to help her. Interestingly, and I came back when you were talking about registering, Judith had registered for a cannabis program some years ago for peripheral neuropathy. We did not take her failure to thrive, if you will, on cannabis at that point, no help for her peripheral neuropathy, as an indication of what was going to be going on now. Times have changed, people have changed, indications have changed. So we were more than interested in trying. Some of the anecdotal evidence that I read about in the literature that Ken and Amanda talked about supported the let's try it and see if it will help.
Okay. Can you hear us?
I can hear you.
Okay, great. Did you have any issues, or was it how was it navigating the certification process?
A lot easier than it was 15 years ago, 12 years ago, in the registration program. Actually, it went extremely smooth. You and Kevin came up with a suggestion. Kevin made sure it was there. The most difficult initial parts, how do I put this politely, was when the gent showed up with the brown paper bag and I had to pay cash money to purchase. That kind of puts a damper on it. But since my wife was not aware of it, it was my problem. So that was the only issue. And now Kevin has worked with me so that even that's resolved, and we are able to pay in a more adult way and have medication, which is what it is, delivered. And so even that's smooth. So I would have to say it was really easy.
Great. So just for some clarification, the reason that I was involved with, Walter's Wife's Care is because before I came to the Office of Cannabis Management, I was a dispensary pharmacist as well. So I was involved with that initially. I am not now because I am at the OCM. So just wanted to clarify that. Okay, so Kevin, what are the most common questions patients have when they visit the dispensary for the first time, especially among seniors?
Sure. There's quite a few questions, and we do see a lot of repeat similar questions. Some of the top ones are related to insurance coverage is one of the real common ones. And with the federal laws the way they are right now surrounding cannabis, there's really not any insurance coverage out there that I'm aware of. I've seen a couple of workman's comp cases cover certain patients' products. And I've seen some reimbursement through something like a health savings account or a flex spending account, but it would depend on kind of who's monitoring that account or who's the administrator on those accounts. So it's only been kind of sporadic coverage related to insurance. Other than that, concerns over smoking or being high, and there's a whole conversation we have when we do the consultation about different dosage forms, because there are quite a few different dosages or dosage forms and products on the market. So, I would say 3/4 of the products you don't need to smoke. So there are certainly all ways to consume it without smoking. And as far as impairment goes, that completely depends on the blend of cannabinoids. Something in the high THC category certainly could be impairing, but the more CBD dominant products or the combination products, there are ways to manage that impairment and treat patients without having any significant impairment. They can still drive their car and they still go to work and everything like that. Other than that, some concerns over potential for dependency. We see a lot of patients looking to reduce usage of opiates. So opiate dependency is one of the things we do talk about a lot. And with cannabis, there is the possibility for some psychological dependency, but that can also be said for chocolate and gambling. That makes you feel better, you're going to want to continue using it. So in that sense, it can have a little bit of like that psychological dependency piece. But from a physical standpoint, there really isn't any significant physical dependency that can develop. CBD and THC actually can help manage the symptoms of withdrawals and actually make that process easier to help reduce opiate use or come off of other addictive substances.
Great. I did actually want to mention that you do get discounts at registered organizations. So registered organizations are the vertically integrated medical cannabis companies operating in New York. So you do get discounts, right, Kevin?
Yes, we offer discounts for senior citizens, anybody dealing with financial hardships, Social Security, disability, and really in Medicaid, Medicare patients too. All qualify for a permanent ongoing discount. And then there's also an initial new patient discount as well, and a robust loyalty point program. So there are quite a few ways to save on cannabis purchases at the medical dispensaries.
Okay, great. Thank you. And Dr. Weinberg, what clinical evidence most influences your decision to recommend cannabis versus traditional therapies?
Well, it's interesting, having my background for 32 years as an emergency physician and then doing urgent care, I certainly have an array of experiences with all the different conditions that one might come across. But I've increasingly seen so much help for so many conditions with cannabis that I'm really tending much more. And again, the people who are coming to me have already, and I'm sure that Kevin sees this as well, they've already tried so many things. A lot of the people, especially the elderly who've been influenced by reefer madness and all the propaganda, have only come to cannabis after they've tried so many other things and nothing else has worked. And so, they're at that point, they're very happy to try it. And again, the first thing they say is, I don't want to get high. And again, and I think one of the things that Kevin was probably alluding to is we're always starting. I think everybody needs to know we always start very low, the lowest dose. So we go slowly up, especially with the elderly, because they may be much more sensitive to the effects of cannabis than younger people. But we're starting at low doses where we're not really concerned about those effects. In fact, Kevin and I saw somebody recently, a woman in her 80s who had very bad back pain. We recommended a high CBD product to her. She took it once and said, oh, it made me a little squirrely. And we said, well, you know what? Then why don't you take it at night for a couple of nights? And sure enough, that worked. And now she's taking it during the day, no bad effects, and getting tremendous help for her back pain. So,
Yeah.
And again, and we may talk about this later, but I think that's one of the things that I really appreciate about the program in New York State, that there is a pharmacist always on board to talk about these things with the patients who have their own, like Kevin and tremendous experience.
Thank you. I mean, the guidance is very important from, the practitioner and the pharmacist like yourself, Kevin. So Kevin, what are the most important safety considerations you discuss with patients starting cannabis therapy?
Sure. So, very much like Ken said, from day one, we adopted that start low and go slow approach. part of that conversation is assessing somebody's history with cannabis use, because not everybody is treated the same way. Cannabis dosing and the therapy is a little bit less linear than traditional medications, in the sense that dose can be very individualized. It can depend on metabolism rates and genetics, body size, previous use history. How if somebody's a frequent cannabis user, they're going to be able to tolerate a much higher dose without side effects than somebody coming in brand new to cannabis. So that is part of it, and that's all that go slow mentality, that start low, go slow, looking for that lowest effective dose. Also, if somebody's brand new to cannabis, I like to incorporate CBD with the THC. The THC is the psychoactive component of the plant, so the high THC products are definitely more impairing than the other products. When CBD is in combination in either an equal mix, or if there's more CBD than there is THC, it can help lessen the impact of that psychoactive or that high feeling, and can really help patients manage those potential side effects. And just as Ken said, there's typically also a little bit of an acclimation period. That first week or two, you're a little bit more likely to see some of those side effects. And these side effects we're talking about are primarily dizziness and drowsiness related, possibility for impairment with higher THC products. And in very, rare cases, if somebody's taking a very high dose of a high THC product, you get paranoia or anxiety type reactions, but generally very safe as far as a therapy goes. That being said, there are some potential interactions. CBD can slow down how quickly our bodies clear certain medications. They are very few and far between as far as those interactions go, and really only seen with higher doses. I would say more common interaction would be sort of like additive side effects. Most medications, there's a lot of them out there that have dizziness and drowsiness type side effects. And the more medications you combine together that have those same side effects, the more likely it becomes. So in our elderly populations, we do a lot of counseling on fall risk, because going from sitting to standing or laying down to standing up quickly, you get that moment of, and we don't want somebody to tip over and injure themselves with a fall. So that is part of that initial counseling, just to be aware of it. And really just monitoring and being aware of the potential is prevented. I haven't had anybody fall in 9 years, so I want to keep it that way.
Awesome. Great. So Ken, this is kind of similar to Kevin's question, but I'd like to know how you handle situations where patients are taking other medications that might interact with cannabis. Like, how do you handle that? How do you advise a patient or a caregiver?
Right. And so obviously before I see a patient, I get a whole list of whatever mids they may be on. And so I'm taking that into account when I'm deciding what to give them. And again, I think it's great that we have the pharmacists there, because I feel like the pharmacists provide another backup for, they may say, oh, you know what, Ken, I just read something and there's some reaction going on here, and you should know about that. But I'm always taking that into account. And again, as Kevin said, it's pretty unusual for there to be significant reactions. But I'm looking at what they're taking immediately and taking that into account.
Okay. Well, thank you. So Kevin, you touched upon some of the cannabinoids like THC and CBD. Can you talk about, sort of what they're used for, and maybe touch upon like the other maybe minor cannabinoids?
Sure. Yeah, and THC is probably the most well-known, but THC and CBD are the primary two. There's something like 117 different cannabinoids that have been identified so far, and they're learning more about the plant all the time. So there's lots of stuff going on inside the cannabis plant. But the big ones I would say are THC and CBD, and then relatively newer on the market would be something like CBG or CBN or CBC. And these different cannabinoids are used for different purposes. There's definitely some overlap there. THC, as I said before, is the psychoactive component, so that's where the high is coming from. But it's also where the majority of the pain relief is found. So patients dealing with chronic pain or pain conditions, incorporating that THC helps to address the pain symptoms. THC is also where the majority of the appetite stimulation comes from. It can help with nausea, and it also can help with sleep issues as well. CBD is used more on the relaxation side of things. So with CBD, we're looking at managing anxiety or PTSD related symptoms, muscle spasms, can help with nausea or seizure conditions. It's also have some mild pain relieving effects, and can be utilized also to help kind of offset some of the potential side effects of THC. CBN, or cannabinol, is one of the newer ones on the market, just the last couple of years. And you'll see CBN with sleep-specific products. So cannabinol is a slightly psychoactive cannabinoid, and that's because it's formed when THC breaks down. So over time, THC degrades into CBN. So if somebody has a bag of weed that's been sitting around for a while, it's probably going to make you pretty tired because that THC has started to convert over. But on the medical market, you'll see CBN with sleep-specific tinctures or sleep-specific gummies because it can help to address pain, but also it causes some drowsiness. So you'll see it in those products. CBG, cannabigerol, is often called the mother cannabinoid because this is one of the early cannabinoids that forms when the plants are really young. And as they grow, that CBG is metabolized into the other cannabinoids. So it's metabolized into THC and CBD and some other things. But CBG does really well with inflammation. So it's not quite as common as the other three that we just went over, but CBG is great for pain and an anti-inflammatory product. And then probably the only other one that could be in that top 5 is CBC, or cannabicramine. And CBC is, again, used in the anti-anxiety and relaxation type effects. One of the things where CBC is somewhat unique is it can stimulate progenitor cells in the brain. So it's being explored right now, specifically with patients who have cognitive degeneration. So Alzheimer's dementia patients would be perfect candidates for CBC. That one's a little harder to find, though. That's not very readily available.
Got it. So, you are all doing something really interesting and sort of, we would think it's sort of innovative. I think it is, but, so you are working with seniors in senior living facilities. So Ken, how do you assess whether a senior living resident is an appropriate candidate for medical cannabis, considering their complex medical profiles?
Yeah, and the fact that they're usually on a bunch of meds.
Right.
What I have found, and I have to thank the OCM. I mean, as everybody probably knows, when the law went into effect, there were initially just 10 qualifying conditions, and then when the law legalizing adult use went into effect, basically the OCM said that any medical condition that a practitioner thinks would benefit allows them to qualify. So that's given me a tremendous latitude in terms of what I can do. And again, knowing the different problems that seniors have that we've talked about already, whether it be the psychological problems or the pain problems, digestive problems, intimacy problems, any of them I'm using, and I'm feeling really could benefit. And I just wanted to say something else, that because I've been thinking about this a lot. I think that what we have been offering, and I don't know how many other practitioners do this, but I love the fact that I'm able to work with Kevin and other pharmacists. I feel it's like a concierge service that we're providing. Anytime I see a new patient, and Walter is a perfect example, I met his wife, we decided what to do, and then we had a long conversation and consultation, the three of us, Kevin, Walter, and I, taking advantage of my expertise and Kevin's expertise with what Walter was looking for. And I really think that's a great thing about the way the whole process works in New York State. And I hope that other practitioners are taking advantage of that, because I think it really makes it such a special, helpful process for the caregivers and the patients themselves.
Yeah. So, like, what are you seeing? Like, what are you certifying patients for, mostly in the senior living facilities? I know you mentioned like chronic pain, just in general, but like specifically in the senior living facilities, what are you certifying patients for?
Right. Well, what I'm doing mostly these days is patients with cognitive issues. And it's interesting because Kevin mentioned the fact that CBD is so good for anxiety. And what I realized after doing this for a while was that a lot of the behavioral issues that we're being asked to see, and that the patients with cognitive issues are manifesting, are from anxiety. Because anybody, as they are losing their cognitive abilities, becomes anxious. It's really frightening. and
Mhm.
they no longer have the prefrontal lobes. They don't have the executive function anymore to inhibit those impulses that the anxiety would be controlled for in patients without the cognitive impairment. So we've been doing a lot with the anxiety and using high CBD products, and it's been very gratifying. I mean, Walter can speak more about this, and he's alluded to this already. But one of the things that we're seeing the most is that when patients or clients in the morning need to be bathed, they get very agitated, and it's really an intrusion on them, their independence, who they are. All
Mhm.
of a sudden, somebody is trying to put them in the shower, and before using cannabis, a lot of these facilities will be using benzodiazepines. They'll be giving them Valium just to calm them down. We are now using these high CBD cannabis products an hour or so before they're going to be bathed, and almost to a person, they have been so much more pleasant and easily. They just work with the caregivers, and I think that's one of the biggest things. You know, there was a study that was done in Israel a few years ago with patients with cognitive issues, and one of the things, and it was a high CBD oil that was very helpful. But one of the things that they looked at in this study that I haven't seen in a lot of other studies was they were looking at caregiver satisfaction. And there was a great
Mhm.
increase in caregiver satisfaction for the patients who were being treated for these reasons. Also, for the fact that we know that THC and CBD are very good for muscle tightness. So a lot of these people don't even want to get up. But when they
Mhm.
get this cannabis product, it's easier for them to move around. So again, it's easier for the caregivers. I mean, there's so many things, but those are the ones
Yeah.
that I'm really seeing a lot of.
Right. So Walter, my question is, how has medical cannabis impacted your wife's quality of life and symptom management?
I want to answer that, but I want to preface it with something, because you are hearing about a unique set of circumstances. I graduated from medical school in 1966. It was a few years ago. And in all my years, this is the most unusual interaction of doctor, patient, and medication. And I'll put Kevin into the medication. Most often, you write a script, somebody goes home, and you don't know what happens. You don't see. There's an intimate interaction that allows the adjustment of dosage and the observation of results in real time. And so when you ask the impact, it's been a dramatic impact. Judith went from um, sort of very reserved, staying in her room, very dour, unhappy, not doing very much in an environment where there are lots of opportunities. And with dosage adjustment along the way, has become a much better affect, participating in what's going on. And a good example and remember, this is one patient. So I'm not telling you about 100 people. This is just one patient. She stopped reading the newspaper several months ago. And during the course of being on cannabis, went back to looking at the newspaper and then went back to reading it. Now, I'm not going to say it's a
Out
cure-all.
loud, reading it to you, right?
Oh, reading it actually to another resident, but that's another story. And so the impact has been dramatic. But again, this is not something you can go into your local dispensary and say, my aunt, uncle, wife, cousin, give me what you should. This has to be thoughtful, or it's going to be hit and miss. You may not know whether you're doing the right thing or the wrong thing. But the impact on Judith has been dramatic. I don't know how many other people who are resident with her in the facility are taking cannabis. Um, I made the somewhat light comment to the people who run Coterie that they should add a third spigot, not water, cold water, and cannabis, because virtually everybody in that building can use some help. You're not there because you're young and have a completely normal mentation. And so it's, I won't go on anymore, but it is dramatic and great.
Thank you for that, Walter. I wanted to kind of go back to something, Kevin, regarding dosage forms. So, as Walter just spoke about, changing doses, it's a collaborative effort, but also it's so nuanced. So can you talk about the different dosage forms and maybe like the onset and duration of certain products?
Absolutely. When we do consultations, I like to start out with kind of a priority list on what our goals are. What are the major symptoms we want to address? What are we trying to do? And once we establish that, then we can take a look at the products, because the products are going to be organized really into 4 main dosage forms. And then each one of those is going to have different mixes of those cannabinoids that we were talking about. So depending on what that mix is, it'll cover different types of symptoms and have different effects. But as far as the dosage forms go, you have inhaled products. These will be things like vaporizers or whole flower or pre-rolled cannabis joints and things. Or we have sublingual products, which would be tinctures, liquids, and sprays for in the mouth. There's topical products, and then there's edibles. And the biggest difference between these different methods of consumption, I would say, is really more in the timing of the effects than anything else. Inhaled products have a very quick onset. So onset of effects are within minutes, so full effects within 5 to 10 minutes, initial effects within about a minute. And they're shorter acting, so they'll last about 2 to 4 hours. When it's dosed in the mouth, sublingual, it gets absorbed directly through the mucosal membranes in the mouth into the bloodstream. Onset time is about 15 to 30 minutes, usually lasts about 4 to 6 hours. With topicals, it's very similar timing to the sublinguals. The unique piece there is they primarily treat where you put them, so you only get that localized effect. So you have to be able to apply a topical where the issue is. And then with swallowed products or edibles, like gummies and chocolates and capsules or tablets, they're going to be a little bit slower as far as the onset goes. Average is about 60 minutes, full effects within 60 to 90 minutes. And then they typically will last more in the 6 to 8 hour range. So, a lot of factors come into, how we decide on a product or what are we looking to treat. If we're trying to help somebody sleep through the night, one of those longer acting products is generally going to do a little bit better than something short acting. Or if somebody needs to dose first thing in the morning, but they don't want to be feeling the effects in the afternoon, something shorter acting may be more appropriate. And depending on those symptoms is where, then the conversation on more CBD, more THC, or a combination of the various cannabinoids comes in.
All right. Thank you, Kevin. So I think, some of our audience might be interested in sort of like what the process is, because what you guys are doing is kind of different, right? Because it's a senior living facility. So, how do you do consultations? I know that Walter spoke about this a little bit, but, is it the 3 of you speaking together? Just tell me about the process that happens in the senior living facilities, from the beginning to sort of how the patient receives their meds.
You're asking me for that?
Whoever wants to answer.
Go for it. Yeah, it starts with you, Ken, so we should start there.
Yeah, no, I will be reached out to by the senior living facilities, and they'll say, oh, somebody just came in, or somebody we think who's been here could really benefit. And so I will come in and see them and do a consult and meet with the caregivers, the family, etc. I then go home. I will do a certification, which is a very simple process. And when I do it, once I have the certification, I will email it to the caregiver and to Kevin. And then we arrange to do a time that's either going to be a FaceTime or maybe a Zoom or a phone call, depending. And we do that as soon as we can. And then we sit and really talk about the whole situation, as I had mentioned, with Kevin asking, what really the priorities are for the caregiver with that patient.
And I think it's an interesting point that Walter mentioned too. The follow-up is very important. Everybody responds a little bit differently. As I said before, it's a little bit less linear. So it's a very individualized response a lot of the time. So you usually have to get somebody started, and then we do like a 1 to 2 week follow-up to see how everything's going, and not uncommon to need to adjust the dose, adjust the blend, so that it's very common. But once we dial in sort of the effects, we can get somebody a little bit more stabilized. But yeah, that follow-up is very important.
Yeah. So, Walter, are you able to reach out to Dr. Weinberg or Kevin to just kind of talk about, what's going on, or you feel like there might be a medication or dosage change that is required?
I think problem-specific issues are easy to raise and are promptly answered. I'm not going to say by 15 seconds later return email. It's fluid enough
30.
that I haven't had to raise the issue of what's the matter, you don't love me anymore. It really does work. I don't know how reproducible it is because Ken is one person, Kevin's another person. But I think once practitioners, whether they be pharmacists or physicians, see what happens with the patient, it's a self-fulfilling promise, and it's very rewarding. Judith was on one dose of 3 different compounds. One turned out not to be necessary. We juggled first the morning, juggled the evening, and she's been on I don't know, Kevin, you may know better than I do, a stable dose for a long time. But we now have another issue that is raised. And after we're finished with this discussion, I'm going to again reach out to Ken when I've seen my wife. I think the part that is starting to develop, and this is new to senior living facilities, I think in general, is the role of the resident staff. They have changed dramatically over the past 3-4 months from, oh my gosh, cannabis, to, oh my gosh, cannabis. Mm-hmm. And I think that's been a very pleasant thing to see. It's not usual therapy, although when I was an intern, the use of medicinal spirits, either for the doctor or the patient, was a more traditional approach. It's just interesting to see how they've now become much more involved, much more interested, because it makes it better for them as well as the patient.
Yeah. And so, Kevin, I just want to know from like your point of view, how do you keep organized? How do you make sure that these patients on a monthly basis are getting the medications that they need? And what is the process? How do they receive these medications?
It really is a collaborative effort. So I work closely with the nursing staff at the facilities. I also maintain a big spreadsheet when people are theoretically due for refills, and we'll communicate along the way. We get within a week or so of needing to do a refill, and they'll reach out to me or I'll prompt them, just inquiring on refill timing. And once we establish what's needed, we'll start that process. If we need to make changes, I reach out to Dr. Weinberg, and he's very responsive. If I'm not available, anytime one of the medical dispensaries is open, we have a pharmacist on site. So if it's not me, it may be Kim in Manhattan or Jim in White Plains. So there are pharmacists always available for consultation by either providers or by family members or patients. And we'll get the product ready. We'll reach out to the family member to arrange payment, and that can be a little bit of some juggling there, because with the federal laws, there are some restrictions on forms of payment that are accepted for cannabis. With the federal laws and the banking laws, the banks cannot do any of the processing. So we cannot process credit cards, we cannot process checks, we cannot take a debit card number over the phone or anything like that. So we're a little bit restricted in that sense. We are available. We can do debit cards in store. They have to be inserted into a device, is why that's only in store. We can do cash either on delivery. Sometimes patients will leave it with the front desk at the facility, or they'll have a family member meet us there or something like that. They can also come into the dispensary to pay for it prior to the delivery. Or we have some third-party portal that can do smart device to smart device payments, sort of like a cannabis-friendly version of something like PayPal or Venmo. And that way we can get that payment remotely with the caregivers. But once the details are all figured out, then we have one of our delivery teams take the products to the facility and deliver it to the staff. And the staff, since the facility is registered as a caregiver, can accept those deliveries and handle all of the products and everything without issue.
Themselves can be registered caregivers, but also the caregiver, of the patient can be registered just in case if, you're in a bind, that the caregiver is able to, bring the medications over to the patient at the senior living facility.
Correct.
Okay.
Yes. So that's always an option. Yep.
Yeah. So Walter, this is the last question before we take audience questions. I want to know, what advice would you give to other caregivers considering medical cannabis for loved ones?
That's probably the most complex question that's been asked. Um, I'm the first one to say there's a complex interrelationship between care provider and care partner. Um, and I've seen the gamut. I probably have run part of that gamut myself. I think to the extent that you are actively involved, and I hope you would be, that observing the kind of behaviors that we're talking about, whether it's moping, staying in your room, not interacting with people, deterioration in cognitive abilities, you need to speak to part of the healthcare team that you interact with. It doesn't matter whether it's a physician or a nurse or an aide or God knows whatever it is, whatever your conduit is back into the care system, and let it be known that you're interested in and want to pursue what is necessary. During the course of Judith's stay, she had an early set of episodes of anxiety and acting out. And the response was to give her medication, which may have been appropriate for someone who acted that way if they didn't have dementia. She reacted to it horribly. There was no follow-up. That was nearly 2 years ago. Things have evolved. You need to be the best proponent of what's good for your partner and continue the interaction. The more interested you are, the more you can help what's going on. You just need to reach out. Each system is different. At Coterie, I could reach out to the nurse. I could reach out to the social worker. I could reach out to the wellness, the aides who took care. I could reach out to the geriatric care manager, and then through them found Ken. So you need to use whatever conduit is available to you.
Okay, great. Thank you so much for that. Why don't we take some questions from the audience? Okay. So are there long-term effects to one's brain/memory with medium to long-term use of medical cannabis? I started in 2016, 2017 using medical cannabis. Whoever wants to answer that one.
I'd love to hear what Kevin says, but I think, people often say, oh, well, people have memory issues with cannabis over the long term, but we're seeing the opposite. And I think all of those studies or all of those anecdotal reports were really about, these cohorts of very disparate groups of people. How much were they smoking? What were they smoking? How often? Now that we have more control and we're really looking at it in a more scientific way, I think I would say, from my experience, that there are not. I wouldn't be concerned about long-term memory effects, negative effects with cannabis.
I would echo Ken. Also, CBD and some of the other cannabinoids are very neuroprotective. So, if anything, in the long run, I would think it could preserve your cognitive function and memory. That being said, if you're using a high THC product with memory-related issues, short-term memory loss is one of the potential side effects. But that's more if you've overconsumed a little and you set your keys down, forget where you put them, kind of thing. Once the active effects wear off, it's not like it's permanent or any kind of long-term concern.
Okay. Our next question is, what is the primary difference between smoking cannabis and using edibles? Would that be for Kevin?
Sure. So biggest difference off the get-go is going to be the timing. So inhaled products will be very fast acting. They kick in right away, and they'll be shorter lasting. So they'll last in the range of 2 to 4 hours. With ingested products that are swallowed, it's going to be a delayed onset time, and they can last much longer. So I've had patients have experiences for 6 hours. I've had patients have experiences for upwards of 12 hours. So it can depend a little bit, on the person there. And there are some factors that can change the effects with orally consumed products. So if it's taken with a high-fat meal or snack, for example, fat helps with the absorption, and those effects can be a little bit more pronounced with that dose. And there is a metabolite that's created with orally consumed products. 11-hydroxyl THC is created in the process as it's absorbed through the digestive tract and through the liver. And certain patients can be either very susceptible or somewhat resistant to that metabolite. So there is the possibility, maybe 1 in 20 or something. I don't know what the exact statistic is, but there are certain individuals that may be a little bit more sensitive to the effects of edibles, specifically related to that metabolite, because it can be something like 5 times more psychoactive than THC.
So do you tell patients to kind of, wait a few hours before, if there's an effect, or, to wait and then repeat the dose?
Yes, usually tell people wait at least an hour, if not 90 minutes, before repeating any doses, just so it doesn't sneak up on you and get a cumulative effect. And general recommendation with gummies and edibles is take half first, see if you like it, and then take the other half.
Good advice. Okay. So Nina asks, who is actually dispensing the medication to the patient?
So that would be either the pharmacist or curator, which is our sales representatives in the dispensary. Very similar to a pharmacy technician role. So you'd either be meeting directly with the pharmacist if there were questions, or if you were just picking a refill up, very similar to going to a regular pharmacy and pick up your refill, you'd meet with one of our curators and they cash out just like you were at a pharmacy.
But she may be asking also about who's getting it at the actual
sure.
facility.
It would still be one of our curators that would be driving one of our vehicles as a delivery vehicle to the facility to deliver the products. Once it's received at the facility, then it's the facility staff from there between delivery to patient.
I took the question in a more narrow perspective, which is, at least in coterie, it is treated like any other medication. So it's dispensed by a nurse, and it is maintained and covered in the same way that you would any other medication. If this was a home situation, obviously the care provider, or if there is an official aide, can do it. You don't have to be licensed. Correct me if I'm wrong, Kevin, but you don't have to be licensed to do that.
As a caregiver, no, that can be a friend, a family member. As long as they live in New York State and they're at least 21 years old, they can register as a caregiver, and a patient can register up to 5 individuals to be their caregivers.
Yeah. And a caregiver can have 4 patients that they oversee. Okay. This is for Dr. Weinberg. Since cannabinoids are anti-cholinesterase inhibitors, which ones do you recommend to improve mental function in patients with Alzheimer's? Which ones inhibit or /clear amyloid plaques?
Okay, well, anticholinesterase inhibitors. I don't know that I really think about that element. I feel like maybe I should, but again, based on what we've been saying and what Kevin was talking about, we're using mostly the high CBD products because of those, really they are neuroprotective. And in fact, I've had several patients now where the memory has seemed to improve with cannabis. Family members are telling me that. They're telling me that someone who had not really been interactive before is now interacting. They're having conversations, not elaborate conversations, but they're actually having a back and forth where it's clear that their loved one is understanding. Now, in terms of, it's very interesting about amyloid plaques. I do a lot of work with Care in Kind, which is the Alzheimer's Foundation of New York, and we talk about this. And I have to think back because I gave a talk to them last year about. Oh, actually, that's a good question because THC seems to be one of the better. It seems to have some ability to decrease the production of amyloid plaques. And if you wanted to reach out to me, we could talk about it more. It's a great question. Obvious. And is amyloid plaque what causes Alzheimer's? I mean, I think that's a controversial issue as well. But I'm happy to talk about it more if somebody wants to reach out to me because it's really interesting stuff.
Okay. Are there any medications that make cannabis absolutely contraindicated?
Kevin, what?
Not that I've come across as of yet. The only time I run into hard stops is with either personal or close family history of schizoaffective type disorders with high THC products, because there's the potential to precipitate a psychotic incident, or with certain cases like ischemic heart disease or severe heart disease, because you worry about THC and CBD can have a little bit of vasodilator effect. You get a little bit of a rapid heart rate, as some very minor transient effects when you're first starting. So somebody with concerns over cardiac function or concerns over schizoaffective type disorders would be really the only cases where I'd have a conversation where we have to weigh the benefits and risks. As far as medications, I haven't run into a scenario where we weren't able to manage a patient with their medications. With certain things like blood thinners and that kind of thing, there are things to look for easily.
Right.
Looking for the signs of bleeds and that kind of thing. So it a little bit of a case-by-case basis, more focused on managing potential side effects more than anything, but I haven't run into any medication-related contraindications, no.
Yeah, and Sang, this is something, well, the three of us have talked about a lot. That's always been a concern of mine, the blood thinners, but I think we are able to control it, and it would not be an absolute contraindication.
Right. Walter, who administers the cannabis to your wife? Do you or the nurses?
In the senior living facility and memory care that she resides in, all medication is administered by a nurse. So there's no optionality for that. If you said to me as a physician, is that absolutely necessary? No, you're not looking for a change in blood pressure or pulse rate. You're simply looking to give something that's going to change mentation. So it could be done by an aide, could be done by an untrained individual known as a care provider. But in where she is, the nurses do it.
Okay, so question from Diane. How many milligrams of CBD to reduce anxiety?
And again, Kevin could talk about we're always starting at the lowest doses, but usually 25 to 30 milligrams twice a day. You want to dose CBD twice a day to maintain levels. So I would say starting there. Kevin, I don't know, what you have any other thoughts?
Yeah, with CBD, I usually mimic 10 to 20 milligrams as an initial dose, and either once or twice a day as a starting point, especially with the high CBD products. On that same sort of CBD topic, I just want to point out, not all CBD is created equal. So you want to be careful where you're getting your CBD. CBD has become very readily available these days. I've even seen it at the gas station down the street, so it's all over the place. But watch labels. Things to look for are try to avoid, any industrial hemp paste products. Look for labeling like broad spectrum or full spectrum. That just means that they're pulling additional compounds, the other cannabinoids, terpenes, and things from the plant, and it's going to work better because they have a cumulative effect when they work in combination. And then also try to find something that's third-party lab tested, because over-the-counter hemp-derived CBD is technically a supplement. There's a lot less oversight on the supplement side, so you want to make sure that you're getting it from a company that's doing third-party lab testing and validating their products. Hemp and cannabis in general are what's known are bioaccumulators. So they are great at pulling heavy metals and toxins and things out of the soil. They clean the soil, and you don't want any of that in your products or your supplements. So you want to make sure you're getting from a source that's looking for it and doing the testing and due diligence.
I always mention, and that's a great, really important point for people to know about not getting things on the street. They used industrial hemp to clear up the radiation after the Chernobyl spill.
Yeah.
So think about that. It was just, you want to make sure that it's third-party lab tested.
And any of the products coming out of the medical dispensaries have gone through some rigorous testing through FDA registered laboratories. So there's a lot of checks and balances and safety double checks on all the medical products. If it doesn't pass the quality assurance testing, I don't even get it delivered here on site at the dispensary.
Okay, Dr. Weinberg, with sundowning, is evening the best time generally to take cannabis?
It depends what you're taking it for. And again, I have a number of patients who are taking it yet for sleep. So that's a good time to be taking it, I think. Or at bedtime. Again, like I had said, when people are first starting out, a lot of times it's better to take it at night before sleep, because then, you're not going to really worry about any kind of side effects from it.
Thank you. Okay, what is the best choice for seniors with arthritis?
With arthritis, I mean, I usually recommend a combination. With arthritis, there's an inflammatory component there, and there's a pain component there. So the CBD side would help to manage the inflammation, and having a little bit of THC on board to bring in some initial pain relief. As far as the dosage form, that would depend on the person's schedule and what their personal preferences are. But I would usually look at kind of one of the 1-to-1 or an even combination of THC and CBD for something like that.
How about like topicals or balms?
Sure. Depends on where you're putting it. If it's arthritis in sort of the smaller joints, fingers, hands, shoulders, elbows, bottoms of the feet, that kind of thing, they do very well. If it has to penetrate really deeply, if we're talking like deep like hip pain, it may not penetrate deep enough as a topical to really get adequate relief. But again, it would depend a little bit on kind of cervical area and the individual that's using the product.
Great, thank you.
The patients do really well with the topicals. I've been impressed by
rheumatoid in the hands especially is where I've seen great success with the topicals.
Okay, last question. Are there any association between regular cannabis use and fall risk incidence among older adults?
What is regular cannabis use? I mean, if people are getting wasted, I think then there's an issue. But, I think responsible use, I don't know of any associations when people are using it responsibly and thoughtfully. I don't know, Kevin.
Yeah, I would say it very much depends on the product and the blend of cannabinoids there. Dizziness, drowsiness are the most commonly reported side effects, but a dose of 5 to 10 milligrams versus a dose of 25 to 50 milligrams has very different results when we're talking dizziness, drowsiness. So it really depends on dose and the product we're talking about more than anything.
And I'm going to flip that over. With cannabis, it has allowed Judith to be energized, focus, and concentrate on her physical therapy, and her ambulations have improved, her balance has improved. So you need to, it's really a 3-dimensional puzzle. You can't just look at one issue. Older people fall, older people take cannabis. That doesn't mean that cannabis caused the fall.
No, that's a great point, Walter. And that's because people do focus more. It's cannabis is a very physical product. And that's lovely. I'm so glad that you mentioned that.
Yeah. Well, thank you so much. This was an amazing discussion. I thank all of you, Dr. Weinberg, Kevin, Walter, thank you so much for joining us today. So as we conclude today's discussion, I just want to remind everyone that the replay of today's session, along with the actually we don't have slides, sorry about that, will be available on our YouTube. And at the end of this webinar, you'll be automatically redirected to a post-webinar survey. So please fill it out so we can, make our webinars better. And your feedback really just helps us to improve it. And we also encourage you to sign up for our newsletter to stay connected with us and updates. So please subscribe. You should be seeing the links go up soon. And you can also visit our website, cannabis.ny.gov, for more information on the medical cannabis program. And you'll find caregiver information there, so caregiver and the caregiver facility information. And I just want to mention for June, we will have Dr. Dylan Zilla for Cancer Survivors Month, and he will provide an overview of cannabis use in patients with cancer. So please stay tuned for that and the dates and the time. So we just want to thank you very much for joining us today, and we'll see you next month.
Thank you.
Thank you.
Thank you so much.